I was diagnosed with breast cancer in 2020. It had a huge impact on the family. My husband and I told the children together. It's a difficult thing to say to them. I think if you are unlucky enough to be diagnosed with breast cancer in Worcestershire, then actually you're probably in the best part of the country.
Hi, I'm Rachel. I'm one of the breast care nurses here at Worcestershire Breast Unit, and I'm joined today by Becky, who's one of our lovely ladies that has been through treatment here at the Worcestershire Breast Unit, and also Corinna, who is with the Worcestershire Breast Unit Haven charity, who do so much more for all our patients.
Hi, my name's Corinna Parsons. I am Charity Deputy Director and work on the patient support side of the Worcestershire Breast Unit Haven charity.
Hi, I'm Becky. I was diagnosed with breast cancer in 2020, which was in the middle of a COVID outbreak, which was interesting. So all appointments, I had to go to everything on my own. So yeah, my husband was waiting in the car park. So it was interesting. But I suppose in some ways it helped, because when I was going through all the worst bit of treatment, actually the country was in lockdown.
If you don't mind just telling me about the process of when you found something in your breast and you must have thought, I need to go and get this checked out.
I made an appointment with my GP and they got me in straight away when I told them what it was. I was referred to the breast clinic. So my first appointment was here, and I think I was taken into a room to see the surgeon, and then I was sent off for mammogram first. And I think I had biopsies that day as well.
Obviously went through all that imaging on that day when you came to clinic and had your mammograms and had your biopsies, and then you were told you had to come back. How did you feel on that second appointment?
I think I was expecting to be told it was cancer. I wasn't. Yeah, I pretty much knew. So I was expecting it. It was almost in a way a relief to get to the appointment date, because it's 2 weeks when you're waiting for results. And feels like forever. And I think sometimes the waiting is actually the worst bit, because once you know what you're dealing with and you're given a plan of action, you know it's progressing and things are happening to get you on the right tracks.
Yeah, the charity's here to support basically every single patient that comes through here for treatment, whether that's investigations or when they're diagnosed and then afterwards.
This is something that people need to know. I think if you're under 50, you're more likely to have dense breast tissue.
And how old were you?
I was 48, I think 48, yes. So I think originally it wasn't terribly easy to find, didn't show up on a mammogram.
And you mentioned about having dense breasts, and I think, in the younger ladies, they've got youthful breasts, and it is difficult to spot anything abnormal. So it's not unusual for ladies that maybe that have got dense breasts that are diagnosed with a breast cancer. We have men as well, don't come in as well, because men can also have breast lumps. Men getting into a mammogram machine, but they know they're offered exactly the same. And it must have been frightening for you to find it yourself. Did it scare you that you wouldn't get the right treatment at that time?
I think it did to start with. Yeah, I remember saying to friends, I've picked a really rubbish time to be diagnosed with breast cancer. That was how I broke it to them when I messaged them. It did scare me to start with, but actually, as soon as I came into the breast unit, it was obvious that everything was going on just as normal. But I think one of my first questions was, is there going to be a delay, and is it going to affect treatment? And no, my mind was put at rest straight away. It didn't affect anything.
That's a lot to go through. Being told you've got cancer at a young age. How did you manage the thought of having to lose your breast, mastectomy?
I think I wanted a mastectomy. And I think that was the only option. So I would have asked for it anyway, I think. I just wanted to make sure everything had gone.
Sure the cancer's gone.
Emotionally and mentally, there's so much to process of what you've just been through.
And how did it affect your family?
So it had a huge impact on the family. One of them was in her A-level year. My younger one was in his GCSE year. My husband and I told the children together. That was hard. It was... Yeah, it's a difficult thing to say to them. It's a tough thing to say, but then you sort of find you're making everybody feel better, which is what you do anyway. Yeah. It's what you do as a mum. They were in and out of school, so they hadn't got their friendship things,
Their support work.
Yeah, it had a big effect on them, because I think once there weren't lockdowns, they were a bit nervous to go out socialising again. Once I was having chemotherapy, I was quite at risk. They were nervous about bringing something into the house, I think, as well.
Yeah. Did you think it made you a different person? Did you think that it changed how you saw yourself, and it changed your confidence?
Definitely, yes. Yeah. It's strange looking back, but it's been a few years now, and it's taken a while to build myself back up to where I was before. Definitely, I think, yeah, when you've got no hair and no eyebrows and no eyelashes and you look totally different, I didn't look great bald. I see some people now and just think, wow, they look amazing and they rock it, they look fabulous. I just looked in the mirror and just hated it. And I didn't let anybody in my house see me. I always wore a cap at home, always. And I think there was a heat wave. My hair was starting to grow back, and I just went and said to my husband and children, I just said, look, I'm just going to start not wearing the hat. And just to warn you, it'll look a bit weird, but we'll all be used to it, and then I won't be hot and grumpy, and it'll all be fine. And they were fine. They'd have been fine all along. Yeah. Of course they would. Yeah. But I just felt like I wasn't me, I think. So I always had my head covered up. I've seen... I think it was possibly because I was doing it on my own as well, and I hadn't come across anybody else in the same position. I think there's lots of things now that, having met the people I've met, I would be more confident with and feel better about. Yeah. But at the time, I just had to do it myself, I think, because it's almost like I was fine while treatment was going on. I mean, it was horrible, don't get me wrong, it wasn't nice, but the chemotherapy was hideous, and I ended up in hospital and, having trips back in, things going wrong with that. But I knew it was doing something good and it would all be over one day. But then I think once it's all over, it might not be the same for everybody, but I've spoken to a few people who have felt the same, that really then that's it, and it's all over.
What support were you able to access at the time?
I researched a lot online. I wasn't aware of the group to start with. I think there wasn't as much going on. I know, obviously now, I know a lot of people, I've met people since who joined the support group immediately, and it's really helped them. For me, I sort of needed to just get my head down and get on with it. I joined the support group and started doing all of the things that are on offer with them. I think I was post-radiotherapy. I'd got through the other side of it all. I didn't really feel able to socialise really before that. So I sort of built myself up again slowly afterwards, I think. I was at the end of my treatment when I got involved.
I think there were some services online at the time during COVID. So there were some Pilates classes done online. And I think the support group was started up online. We now have Pilates sessions in person. We have gym sessions, PT sessions. I think you might have done those.
I did Pilates and the PT sessions online, and they were really helpful.
Support services in the charity have grown massively. So we now have Nordic walking sessions in Worcester Woods. We have the Pilates. We also fund some hydrotherapy sessions. We try and do as much as we possibly can in all different ways. We're just starting a walking tennis group, actually. And all these things are really set up to try and help people improve their movement, that area under their arm where they've had surgery.
That was the thing I found really difficult. I got very limited arm movement after surgery, because obviously having surgery on both sides as well. Before I did the Pilates sessions, well, my arms were two different lengths when I stretched them out. I couldn't straighten them properly. So by the end of the Pilates sessions, I was normal. I could straighten my arms and and much better. So they're really helpful things to do.
And what's great as well is that both the Pilates, any courses that we're running have specialist rehabilitation experts who are there. They understand all the issues with breast cancer patients and those specific movements that are required to help them. You've been along to the support group?
Yes, I have been along to that. Just go along, have a chat. Let them know beforehand if you're going so they can look out for you, because sometimes it's a bit daunting going to these things on your own if you've not met anybody before. But everybody's so friendly, welcoming.
They just want to welcome new people and help scoop them up and help them with the knowledge and experience that they've had, and just help them feel a bit better. And like you say, some of the ladies have have had breast cancer a long time ago. So it's reassuring for those, the new people. Yeah. Lots of different ways that we can help: sleep therapy, hypnotherapy, different aspects of support. Yeah. And we know how important that can be and how transformative for patients.
I think it was Nordic walking. That was the first thing I found post-treatment. And Sue, who runs it, is brilliant. So she's really knowledgeable about, I mean, Nordic walking is really, really good for people who've had surgery to their upper body. And it's really, really good for you. And I think that's what started my fitness coming back, because you can go along and the groups run so that you can go even if you can't walk very far. There's people of all abilities there. Or if you go because you want to get fitter, then you can still fit into the same group. And it was just a weekly chance to go and chat to the same people every week, so you get to know people. I think that was the first place that I started to feel that I sort of belonged somewhere, and people were really happy to see you every week, and it just made me feel better.
There's a lot to process. Your body's still recovering from treatment. So all these groups and all those support services are there for that reason.
All of these activities you can get involved with, they're all to patients. We can just ask if we can join in. Yeah. So how is all that funded?
Worcestershire Breast Unit Haven is an entirely independent charity. There are only 5 of us. We're very small and we're doing a big job. And we have to raise about $250,000 each year, 250,000, to try and keep this level of support going for everybody. So as an independent charity, we are reliant on all our amazing supporters, fundraisers, donors. It's all entirely fundraising and donations. Such an army of support in Worcestershire. It's amazing. People have bake sales, go on a bike ride, do some crazy things all over the county, and that money comes into us and helps us to be able to put on all the things that we do. Breast Cancer Awareness Month, obviously the biggest month of the year for us. Lots of people doing lots of things around the county. We will be doing Wear It Pink Day, which is Friday, October the 24th. If anyone would like to know any more about any of the things that we've got coming up, you can find us on Instagram and Facebook. Just search for Worcestershire Breast Unit Haven, or put us into Google and you will find us top of the list. Becky, thank you so much for coming along today and speaking to myself and to Rachel. Your story is so important and will be really valuable for people to listen to, so thank you.
Thank you, and thank you for everything you do for the charity, because it really, really helps us.
Be breast aware, know how it feels. If you notice anything different, lumps, bumps, any discharge, go to your GP and we'd be happy to see you in one of our clinics. But if you get an invitation to have your mammogram, come and attend.